So most doctors now are using the liquid-based technology.
Well, not all. I would like to say all doctors are, but not all of them are, because it does cost more, and you have to, have a little different equipment. So not all doctors are using it, and even the health departments, not all of them use it because it is an increased cost.
When should women have their first Pap test?
Women should have their first Pap test within 3 years of becoming sexually active, or by the time they're 21.
Whichever comes first.
Whichever comes first.
And then how often should women have?
Women like to have Pap tests annually because it gives them some reinsurance.
Well, that's been the tradition too.
That's been the tradition.
I mean, I grew up hearing you should
right.
go annually.
That's right. And what we've been telling women is that you should go and have annual Pap tests, and once you've had 3 consecutive normal Pap tests, then you could go to every 3 years. The only time that we would suggest that women continue to go for annual or more frequent than annual is if they are at high risk for developing cervical abnormalities or cervical cancer.
What makes a woman high risk?
That's an excellent question, and not a lot of women know this. So the risk factors for developing cervical cancer, which would put a woman at high risk and need for her to go annually for Pap tests, are if she smokes, if she has a history of human papillomavirus or sexually transmitted diseases.
And we'll talk about human papillomavirus at length in a few minutes.
Okay. If she has had begun sex at an early age, meaning earlier than age 16, if she's had sex with multiple partners, if that partner has had sexually transmitted diseases, if that partner has had sex with multiple sexual partners. So,
and a lot of people don't realize that. You've essentially had sex with every partner your partner has had sex with.
That's correct.
People don't realize that how many partners your partner has had is very significant to your own health history.
That's correct. That's correct. So those are the major things that put a woman at risk. And also, if she's had a prior abnormal Pap smear, then physicians usually have those women come in more often until those are resolved.
And I would imagine too, if she's had a sexually transmitted infection too, that would also put her at higher risk, not just her partner.
Right, right.
Let's talk about HPV, the human papillomavirus, because we know now that HPV causes most cervical cancers.
Correct. Over 90% of invasive cervical cancers are caused by human papillomavirus infection.
And it's very, I mean, this is one of the few cancers that we know is caused by a virus.
That's correct.
What is HPV?
Okay, so we just mentioned that it's a virus. Okay, and what viruses like to do is when you get infected with the virus, and I'll tell you how you get infected with HPV in just a second, but the virus, very crafty little critters, they go and they grab on to the DNA. So the DNA, is a double helix, and the virus will wind itself into the DNA of the cells, and it lives there. And a viral infection can do 3 things. It can stay there for however long. It can go away. So the body's immune system, I like to think of them as little Pac-Men or soldiers that come and realize that that's foreign, that that's the DNA that has something in it that's not right, and it'll eat that, okay, and it'll go away. Or the virus can cause the cell to wake up and start replicating, and it'll grow bigger and bigger. And cells that have the viral in the DNA don't replicate normally, because your DNA is what replicates and makes new cells. And if the DNA is not the same as the neighboring cell, because it has this virus on it, it's not going to look like the neighboring cell. It's going to look atypical, like what we talked about.
That's what we're looking for in the Pap smear.
That's right. So it'll start growing, and it's not normal. So it'll start moving into other tissue, and invade, into other tissue. So how does somebody get infected with the virus in the first place? The way that women or a person gets infected with HPV is through sexual intercourse. And yes, men can get infected with HPV. And it is thought that men can be the reservoir or the holders for the human papillomavirus and then transmit it to women. And then a woman could transmit it to a man who has sexual intercourse with her. And on men, it doesn't cause any problems. No problems at all. So they have this infection they don't know about, they'll never know about unless they get tested. But yet they can have it live in their system and pass it on to others.
Although, can't HPV cause anal cancer in gay men if they have anal sex?
It can.
So it can cause problems in men.
It can, but we're mainly here speaking of a
about
heterosexual relationship, right, and how it gets transmitted for cervical cancer.
Right.
Yes.
Well, let me ask you this. Okay, we now have a vaccine. Because this is a cancer caused by a virus, we now have a vaccine that can be given to girls, right, to prevent HPV.
Right. Right.
It's called Gardasil.
Right.
And many states now, it's newly released, many states now, I just heard very recently, are beginning to require this as part of the string of vaccines that children take. At what age is Gardasil recommended that girls get this vaccine?
It's starting at age 11 to age 26. So
between those ages.
Between those ages. And so a lot of people wonder, well, why are you vaccinating girls, for a sexually transmitted disease? And the reason is exactly what we've just been discussing, that we're trying to vaccinate women before they begin sexual activity, because you don't know, again, if it could be transmitted by a partner who's had sex with other people. And actually, they've done some studies, and people who are sexually active, about 80% of them in their lifetime will have been exposed to the human papillomavirus.
This is a very common virus.
Right. And I'm talking men and women. So even people, in a monogamous relationship, one partner, it might be a monogamous relationship, but you don't know about the other partner. Somewhere along the line, there could have been some infection.
Sure.
But it is a very common infection in sexually active people. However, remember I told you that the virus can cause the cell that the infection progresses to cancer, to cervical cancer. And we just have some bits of ideas in whom it will progress. Those who are smokers, for example, and you're saying, why is smoking? Smoking happens up here. What has it got to do with my cervix? Well, first of all, we know that smoking, suppresses your immune system. So if smoking suppresses your immune system, you don't have those soldiers to come and eat up those bad cells, number one. You can't fight off the infection. And number two, many years ago, researchers have demonstrated that the products in the cigarettes are found in the cervical mucus. So those carcinogens that people are smoking in their cigarettes travel through the body and can actually be found in the cervical mucus, which can have a direct effect on the cervical tissue.